back to the 4th International Conference on Public Health in Africa. As I said, it brings together scientists and global health partners. The aim being to rebuild health systems across the continent and look at research and innovation in the health sector. Dr. Raji Tajudeen, Acting Deputy Director General for the Africa CDC, is joining us now to share some insights on this. Dr. Raji, good afternoon and thank you very much for your time. As I mentioned, the objective being a platform that advances Africa-led solutions, healthcare, innovation, policy, as well as research. Maybe let's start at this particular place. Are we still a healthcare industry on the African continent that largely relies on borrowed technologies and borrowed ideas?
No, thank you, and good afternoon. Happy to join you this afternoon. So let me start by saying that Africa CDC, we came on board almost 9 years ago. And with the repeated recurrent outbreak that we have seen on the continent, it's become very obvious that we need to begin to produce our own health products to be able to respond efficiently, and effectively to that particular outbreak. Now, going back to your question, I would say that in the past, yes, but Africa CDC is changing that narrative. Because we have received a marching order from our head of state and government, making it very clear, that we need to begin to produce these health products locally, and the marching order, the direction of travel is very clear. Come year 2040, we should be producing 60% of our vaccine needs as a continent of 1.4 billion people. And apart from vaccine, even diagnostics, therapeutics, and other essential health products, we should be producing, in that same range of percentage. Yeah. And as part of what we are doing to ensure that we are able to heed and be able to really respond to the call from our head of state and government, yeah. Tech transfer, building appropriate local technology, yeah. Is what we're doing. So that narrative is changing and changing very fast. Yeah. So we are building the local capacity and local technology to drive, this agenda forward. Over.
That's 15 years away, if you like, the decoupling process from that dependency. What does it really entail? I mean, what does it look like, for example, when we are looking at manufacturing, right? Are we building up, like we saw during COVID-19, our own manufacturing factories? Who's funding those? Where are the expertise coming from?
No, thank you. So, it's we are talking about 15 years away, but they are intermediate targets, So, for instance, by 2030, we should be producing 25% of what we need, and by 2040, we should be producing 60%. While we're doing that, we have also put in place a pool procurement mechanism that will allow for equitable and affordable access to these products. And this pool procurement mechanism is about volume procurement, it's about shaping the market on the continent. It's also about looking at what are those priority products, as far as these health products are concerned. Now, in terms of who is funding this, the direction of travel, the margin that is very clear, is around domestic financing. Looking inward, to be able to mobilize the resources to embark on this local or African manufacturing agenda. Of course, we welcome complementarity, from development assistance. And as you all know, the development assistance is also fast declining. So the way to go is to mobilize resources domestically, and most of our member states are already doing that. And whatever that is coming from outside of the continent is to catalyze what is available domestically. Thank you, and over to you.
So there's a general understanding from the member states that the funding for this decoupling needs to come from the countries themselves. And is there alignment on that as far as policy is concerned? I mean, are the policymakers collaborating? I tell you, because, for example, in South Africa, we are currently having that debate on whether or not the South African hospitals should be providing particular healthcare services to foreign nationals, be it legal or illegal in some instances. Doc, are you hearing me?
February that was convened under the leadership of President Paul Kagame of Rwanda, who is the champion for domestic financing for health. And in that meeting, it was very clear to all, the head of state and government that the way to go as far as financing health is concerned is around domestic mobilization, of resources to support by Africa CDC, bringing the ministers of health, the ministers of finance, and other key sectors, from across our member states to really further unpack what was discussed at the level of our head of state and government, bring it down to the level of our ministers of health. And tied to that, the Africa CDC has also launched the African Health Financing in a New Era, which essentially is around supporting our member states to build the necessary capacity to show them the how, of how do we mobilize these domestic resources? How do we mobilize some, go into what I describe as innovative financing, moving away from those traditional supporters or traditional funders of health towards some new way of funding health, like the sin taxes, like solidarity levy, and of course, also leveraging the private sector, the philanthropists, to really go into the infrastructure that will support the health sector, support the manufacturing agenda. So these are the three key pillars under that health financing in a new era. And the key cross-cutting enabler there is to put in place the necessary governance mechanism, that will allow us to be able to really build the necessary capacity at the level of our member states. Over to you.
Let's talk about that, the necessary government capacity and legislation, I suppose, in place. How do we tackle that? How do we approach that in the context of emerging threats in many of the African states, one being lack of infrastructure in some instances, but two, poor governance, adding to that instability in terms of wars and the likes?
No, thank you. If you look at the disease outbreak, as far as the continent is concerned, we are seeing in the last 2-3 years, we have seen 40% increase in the frequency of emerging and re-emerging infectious disease outbreak. Now, in terms of building our member state capacity to be able to, one, use their resources efficiently, that means doing more with less, and also be able to unlock what is available domestically. We first and foremost did, a mapping exercise to understand what exactly is there in terms of health financing plan. And for those that already have the plan in place, consolidate on what they already have, and those that do not have, provide the necessary capacity to support them to develop one. And what we are doing as Africa CDC is to deploy technical assistance in form of public financial management, experts, to support those member states. And much more importantly, to tie that health financing plan to the national development plan of these member states. So this is what we are doing, because whether we like it or not, health, is also a developmental agenda. So we need to build the necessary capacity to see it from that sort of lens. So in the summary, so this is what we're doing in terms of building the necessary capacity to support our member states.
All right, Doc, appreciate your time. Thanks so much for your intervention.